You signed up this time. I got you.
Jill Ackerman, mom of 4 Blue Valley students and a family physician. I trained at Mayo Clinic, practiced medicine in Kansas City for 12 years. Per the CDC, COVID-19 survival rates 99.997% for those aged 0 to 18. And per the American Academy of Pediatrics, severe illness due to COVID-19 is rare among children. Survival rate is 99.5% and higher for patients up to age 70. Private and public schools across the country and abroad have opened successfully with mitigation measures. We now have data that suggests that schools are not the super spreaders that we feared. The Brown University review of 227,000 students from 47 states yielded a low infection rate of 0.13% among students, 0.24% among staff. Similar information is available from Australia, Italy, and countries in Europe where large outbreaks linked to school reopening were rare. Multiple states, including Texas, New Mexico, have shown up to 40 to 70% of students in virtual learning environments have had at least one failing grade, and that there is great concern about the inadequacy of academic achievement in virtual learning environments. Over 43,000 medical and public health scientists and physicians have voiced their concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies. School lockdowns have negatively impacted diet, sleep, physical activity, and obesity rates among children. There's been a shocking increase in the number of deaths of despair in young people when compared to last year. Increased rates of suicidal ideation, depression, anxiety, and substance abuse has been well documented. On October 30th, Dr. Anthony Fauci said reopening schools should be the default position. Dr. Scott Gottlieb said that reopening schools for in-person learning should be the #1 focus for communities. Mortality rates of our hospitalized patients have dropped dramatically. Yesterday, Pfizer announced a vaccine that is hoped to be 90% effective in providing immunity. In closing, our cases, our hospitalizations are increasing in our community. We anticipated this. Now more than ever, it is vital that our community maintain aggressive mitigation strategies to protect the vulnerable, especially our aging population and those with underlying health conditions. Wear a mask, stay home when ill, follow isolation and quarantine protocols, and choose virtual learning for your family if that is your need, and I will continue to advocate for you to have that option. Other countries are seeing similar spikes, yet they have prioritized in-person learning as essential, and they are keeping their schools open. I've applied as a substitute teacher. My fees are paid. I've been fingerprinted. I'm just waiting on the government to do a background check. I'm trying to do my part so I can support our community and especially our amazing educators that can't handle this hybrid. Per your Board of Education website, I will revisit your mission statement, which is to ensure an equitable world-class education and to hold yourselves accountable to the patrons of the district. Members of the board, Superintendent Merrigan, the majority of your patrons have spoken. Please live up to your mission statement. Thank you for your time.
Thank you, Jill. Christine White.